The role of anatomical models for medical simulation training. Supported content by Verta Med Deck 23 2019. The advantages of preparing fine engine abilities by using a progression of recreated techniques are clear. With conversations commonly being founded on augmented experience programming, a pivotal part, which contributes profoundly to fruitful reenactment, is as often as possible ignored: the anatomical model. Actual life systems is just about as critical as the virtual life structures in clinical recreation preparing. Notwithstanding the reproduced piece of the method, instructive worth can be upgraded if what is outwardly looks and feels as practical. An indistinguishable piece of fruitful preparing in an assortment of clinical claims to fame is a truly right anatomical model that can be utilized by a learner. For a student to acquaint with the procedural region and accumulate abilities most productively, a feeling of touch is fundamental. Preparing in reasonable conditions must be done if the mimicked climate is vivid, giving a blend of consistent with life physical and virtual life systems, exact life systems construction to feel and cooperate with, and visuals inside the test system. Arthroscopy is a reasonable model where Verta Med knee, shoulder, hip, and ankle models can be physically taken care of and situated during the reenactment, for various procedural requirements like procuring the essential perceivability of working perspective, similarly as a specialist would do, in actuality. In clinical fortes where control of life systems is excluded from the course of technique, the anatomical model is similarly as critical to work on setting the patient in the right situation before the beginning of the method, especially considering the undervalued hazard for wounds which come from wrong situating over different orders. A further perspective to consider is that all surgeries propose working intently collectively, including the collaborations of various instruments and the right arrangement of colleagues around the patient. It is clear how a climate like this, with restricted actual space, can be hard for students to work and organize development in. In medical procedure, group execution is vital, so a learner is needed to practice such collaborations and correspondence with their companions prior to entering the OR, which goes with the upside of having an anatomical model during the reenacted system. Moreover, for a learner to figure out how to interface with the life structures and facilitate the visual and actual piece of the system effectively, the anatomical model ought to likewise be accurately formed and estimated to impersonate human life systems, thus give the likelihood to encounter similar difficulties as, all things considered, medical procedure, similar to trouble of admittance to a particular life structures. For example, anatomical models in Verta Med test systems give direction for the selection of entries, permitting safe preparing of gateway arrangement and coordination of instruments. Another key component, which empowers the learner to foster essential engine abilities, is haptic input, recreating the vibe of instruments and collaborations with tissue or bone all through the mimic method. Material sensation is the most inconspicuous interface of reenactment. This thought of touch is known as haptics and can be latent or dynamic. For this load of reasons, having a completely expressed, consistent with life, anatomical model accessible along with exceptionally sensible reproduction situations is fundamental for effective and patient well-being centered preparing. Each piece of Vertamed's anatomical models is made cautiously in close participation with clinical specialists all throughout the planet.